effective tomorrow, the state will be enacting a statewide mask mandate. And obviously a decision that did not come lightly. Many factors were clearly taken into consideration with regards to the data and the impact and the effect on our citizens and businesses. As with many mandates across the country, similar mask mandates, this mandate will apply to all indoor public spaces and outdoors as well when social distancing cannot be maintained. We always talk about not just having a single metric or a single data point. What you see here are some of the most important data points around the mask mandate that we've been focusing on. First off, you have our percent positive. Maybe a month, 2 months ago, our percent positive rate was under 1% pretty consistently. Now that we're doing all the antigen tests, when you add the PCR tests into that, you have a percent positive rate somewhere averaging between 4 and 5% right now. And so we're really hitting back to those percent positive levels that we saw all the way back in March and April. For a while, we talked a lot about how more than half the towns in this state didn't have any COVID. Zero active cases of COVID in more than 50% of the towns for quite a while. That number has drastically changed, showing its widespread effect over the entire state, and well more than 75% of the cities and towns in the state now have active COVID cases. The counties that we currently have with what we call substantial spread. Substantial spread is defined as, I believe, 100,000 cases. 100 cases, more than 100 cases per 100,000. It's a kind of a normalization of that data point. 10 out of 10 counties. Every single county, as Dr. Chan alluded to earlier, is officially categorized as having substantial spread. We have our long-term care facility outbreaks. With the 5 outbreaks, I think there were 5 more that we added today. We are back up to 11 long-term care outbreaks. And the 2 big issues that we're focusing on, the biggest variables here, have to do with the economy and healthcare workforce, long-term care workforce. The issues happening within those long-term care facilities, and when it comes to the mask mandate that we're putting statewide, we think we can have the biggest impact and frankly the most flexibility with the economy, but the biggest impact in maintaining our COVID numbers at a manageable level. Staffing, we talk a lot about the staffing shortages in long-term care and hospitals. It really is a crunch nationally. We've discussed that. There's virtually no state that doesn't have an issue, and definitely here in New Hampshire, well over 70% of our hospitals and long-term care facilities have indicated some type of staffing crunch. Some are more extreme than others, but they're all experiencing some level of staffing need. Folks doing a lot of overtime, whatever it might be. That was really the impetus. This data point here, this greater than 70%, was really the impetus in driving the additional $35 million we put towards long-term care facility staff, specifically around Medicaid patients. And we did that last week. And finally, the 2-week hospitalization rate. So over the last 2 weeks, you can see it's just over 100%. I think today we're just about 100 people in hospitals with COVID. 2 weeks ago, that was less than 50. So we have doubled the number of individuals over the last 2 weeks that are currently in our hospitals.